Hello and welcome to North Country Matters. My name is Donna Seymour. I'm a member of the St. Lawrence County League of Women Voters, one of the civic partners for our show. My guest today is Becky Preve. Becky is the executive director of the Association on Aging in New York. She's here to talk about the impacts of the New York state budget and the proposed federal budget on the people her agency serves. Becky, welcome back to North Country Matters. Thanks so much for coming in to talk about the impact that budgets have on our seniors.
Thank you so much for having me, Donna, and I'm super thrilled to be here on behalf of the 59 Offices for the Aging, also known as Area Agencies on Aging throughout the state of New York, that do absolutely wonderful work serving individuals over the age of 60 and caregivers that have some needs in the community.
Yes, I'm very familiar with our St. Lawrence County office, and so I can't agree more with you about what you just said about how important the work all of them that they do is. So let's remind folks just who the Association on Aging serves and just who makes up that population here in New York. We know that longevity is having an impact on society as a whole, and here in New York, especially since New York women have the longest lifespan of any of the states at 91.9 years. That's an increase from 71.2 years in the last 100 years, thanks to better nutrition and better services and better health care, isn't it?
Absolutely. So, as I said previously, I represent the 59 Offices for the Aging throughout the state. And when I say represent, it means that we assist them in their mission of allowing people to age with dignity, autonomy, and respect in homes and communities or in a situation of their choice. And they do that through a whole variety of programs. A lot of people know us for our home delivered meal program. That's really only one small component of the work that we do. We do everything from advising individuals on their retirement plans to health insurance counseling, case management, home care workers in the home to help people age in place. As we talked about the home delivered meal program, and really, we're here on behalf of people over the age of 60 that have questions, concerns, or needs in their community or their caregivers, and we're here to support them. And what a lot of people don't realize is that New York State is actually fourth in the nation for the 60 plus population. We're actually rapidly approaching the 5 million mark of people over the age of 60. And the reason I raise that is that the state of New York is only home to around 19 to 20 million people. We have almost 5 million over the age of 60. We have another 4.1 million caregivers. So if you don't think aging is going to touch your life, you're a bit naive because you can just see that from the population density. And in addition, we have another 3.7 million that are between the ages of 45 and 59. So really trying to support those local offices for the aging to be able to make sure that we can support people where they want to be. And I think what's really notable, especially in the North Country where we're losing assisted living and skilled nursing facility beds, we talked about that growing older population. We're actually losing skilled nursing facility beds on an ongoing basis, and we have less than 110,000 that are licensed in the entire state. So we need to make sure home and community-based care is something that's available and resourced for older people.
You're exactly right about that. And the home care situation is a crisis here in New York State. The other thing I want to mention, especially about those folks who are 45 to 59, many of them are caught between taking care of their own families and taking care of an elderly relative or perhaps an elderly neighbor. And so they're really caught between the jaws in caregiving, aren't they?
They are, and they used to be referred to as the sandwich generation caregiver. We now refer to them as the panini because we feel like people are really being squeezed. And we know from our own New York State data from some of the partnerships that we've launched regarding caregiving that only about half of caregivers actually self-identify. So a lot of people are just doing this work and not calling themselves a caregiver. But we also know that the mental health impacts of being a sandwich generation caregiver actually increases your rate of suicidal ideation by about 4 times. So really a lot of work needs to be done to support caregivers, especially working caregivers with younger children and older loved ones that they're taking care of, because the burden is really significant and the resources are limited.
Yes, that's exactly right. So why don't you highlight for us, Becky, the enormous economic contributions of older adults here in New York? And why aren't we meeting their needs in our state budget when they are such an important part of the fact that we have money to spend?
Well, I think it's this huge misnomer, right? When you think about or talk about the older population, people don't talk about their enormous economic impact. And that's something that the New York State Office for the Aging, under the leadership of Greg Olson, what my office has tried to do, and what all of our local offices have tried to do, is really to talk about the inherent value of the older population, not just from an economic standpoint, but also a social standpoint. And yes, we have to talk about that small subset of the older population that have higher needs or need services, but the majority of older people are still contributing to their communities. And I wanted to share some data with you, Donna, because I think that this is really, really powerful. If you look at the state of New York, older people actually pay $72 billion per year in state and local taxes. They make up about 43% of the tax base. So again, when we talk about why the state should invest in the older population who have needs, they're paying the bulk of those taxes. If you look at what they're doing to support jobs, they're supporting 5.9 million jobs. They generate $482 billion per year in wages and salary. And again, when you look at that in the lens of equity on why we need to make sure that we're supporting offices for the aging, it's because older people are paying for our roads and bridges, our educational system, our healthcare system. Social Security alone, $59 billion annually paid out in New York State. If you look at the volunteerism of the older population, and again, if you look in any community, especially in the North Country, who's volunteering, it's older people that are giving of their time. If we had to pay them for the 442 million hours of service that they contribute, it would cost $13.2 billion. And again, when we talk about those caregivers, right, 4.1 million caregivers in the state that are providing uncompensated care for a loved one, if that had to be paid for at the market rate, it would cost $39 billion per year. So again, 72 billion paid in state and local taxes in a state budget that passed a little north of $250 billion. It's older people that are paying those taxes. And we need to continue to do our work to say, for those individuals that do have those needs, they've paid their entire life to receive those services, and we need to make sure that they're accessible.
You are exactly right, and those are very powerful numbers. They really illustrate the incredible contribution that our older folks have made, and they've made it throughout their entire lifetime. But now they're really giving back a tremendous amount in their golden years, so to speak. So let's dive into the numbers a little bit that were associated with the recently passed state budget. What are the needs of seniors, and what is this 25 state budget doing to meet those needs? Is there good news for seniors in this budget?
There actually is. And, I've been on the show in the past, Donna, where we were very disappointed in the enacted state budget. We were very excited. We've talked a lot about those waiting for services. So when we talk about a wait list, just to back up a little bit, we serve predominantly non-Medicaid eligible individuals. So they make just above that Medicaid benchmark, but they can't afford to privately pay for the service, especially for a home health aide at $40 to $45 per hour. So we subsidize those services because people can't get them through any other service infrastructure. And what we found, due to limited funding, and this has been ongoing since 1965 when the Older Americans Act was passed, as the population grows and inflation grows, we need additional revenue to be able to support people. And because we didn't have that revenue, we were putting people on a waiting list, which means, Donna, if you reached out and I was an office for the aging and you said, I need a home delivered meal and a home health aide, if I couldn't serve you based on funding, I would place you on a waiting list. And so we actually aggregated the cost of what it would cost the state of New York to get all of those people on a waiting list off of the waiting list. And the cost was about $35 million. We were able to get an additional $10 million through the legislature last year, but that wasn't guaranteed for this year. So we did get $45 million for unmet need funds to support people that are on the waiting list, which was a huge win. And those dollars will go directly to service provision in the community for people to be able to access those services.
So that is great news, and it comes a little late compared to how long people maybe have been on those wait lists, but that's good. So are there shortfalls that weren't addressed that still need to be met?
Absolutely. So we did not see the inflationary cost adjustment that we were hoping for. Obviously, I talked about we run the largest nutrition program in the country. Anybody that's been to the grocery store in the last 12 months understands that those prices have gone up. And we haven't had an inflationary adjustment to keep pace. We also were disappointed in the sense that although we fully supported the $2 mandated wage increase for home care workers, because home care workers need to get paid a lot more money than they do, we did not get funding to absorb that $2 rate increase, even though we use the same licensed home care provider network as Medicaid. So that was an additional shortfall. And then obviously we would like to see an increase in our core base service infrastructure. Currently, we can't really advertise those services because the last thing you want to do is say, hey, we want to help you in the community. And then when you come to the network, we have to say, sorry, we can't serve you. That just increases frustration. And obviously the cost of the workforce has increased. So, most of the offices for the aging are based in county government. And so to hire new staff, it comes at an additional cost that's not fully reimbursed by the state. So we continue and we will continue to advocate for additional funding in the state budget to support older New Yorkers. And again, I always come back to that equity issue, right? We should make sure that we have a service infrastructure that serves people that have paid all of these dollars in taxes. And because we're losing those assisted living and skilled nursing facilities that can assist people. So we have to continue to increase our home and community-based service infrastructure.
Yes, and you bring up a great point. One of the huge areas of contention this year has been the CDAP program, the program that actually puts people in the home to keep seniors out of nursing homes. And it helps seniors and the disabled to stay in their own homes by giving them caregiving. So this is not only important for the people who need care to stay in their community and keep them out of these nursing homes that don't have enough beds, but it's also an important economic driver locally because those wages are supporting the caregivers. So let's talk about why that is such a cost-effective program and why are we screwing it up here in New York State, basically, because for the last month, a lot of those folks have not been paid. And it's creating a tremendous stress level on them and on the people they're trying to take care of.
It has. And I think part of that is there was this perception of the consumer directed personal care assistance program that it was fraught with waste and fraud, which is absolutely not the case. And some people feel like a relative of a loved one should not get paid to provide that care. But if you have someone in your family that needs a higher level of care that a home health aide can provide, so I use the example a lot of times, if you have a spinal cord injury and need a bowel program, or if you have a trach and you need suctioning, a traditional home care worker cannot do that, but a consumer directed worker can. And so the importance of the program is number one, that higher level, but number two, we lack licensed home care providers. So we have to use the consumer directed program. And what no one wants to talk about is the cost of skilled nursing facility care, right? If you look statewide, you're looking between $140,000 and $180,000 per year to have someone reside in a skilled nursing facility versus way less than that on the community side. And so we have been working with our partners in the Medicaid system to try to make sure the consumer directed program can continue and that these individuals can get paid, because as you said, Donna, it's wages for the worker in the community that's supporting the economy, but it's also a much less expensive way to serve people that are older or people with disabilities in a setting that they choose. And quite frankly, I don't know a lot of people that would choose to have a stranger provide their care over someone that they trust and have trained. So it's just a great model program that we need to support.
It is. And, these services and supports have been existence for more than 50 years, but they've never been properly resourced, have they? So,
No.
Once again, we're choosing the most expensive care, which would be nursing home care, over getting people to be able to stay in their own home and in their own community and with their own support network. So, I know the only assisted living facility here in St. Lawrence County closed last year, and a lot of those people were shipped to other counties, which meant they were not close to their own family members anymore, and they were certainly out of their normal support system. So that just doesn't make any sense. So one of the things that we know, Becky, is that the state side funding is driven by federal dollars, and the federal side is chaotic, to say the least, this year under a new administration. Governor Hochul has already warned the state legislature they may have to come back to session if the federal picture changes dramatically. So what can you tell us about the federal budget picture as it stands right now, as it relates to the senior population?
So there's a couple things that I want to highlight, and I've been doing a lot of work across the state, but more recently here in the North Country, in really educating individuals about what truly is happening in Washington. I think there's a lot of different ways to digest your news. There's a lot of non-factual information, and we live in a really politically charged environment, right? What I have tried to do is educate individuals on the fact that what I'm going to talk about, I would talk about regardless of what political party was sitting in the White House. This is just factual information. There are two documents that you can reference. One was the leaked Office of Management of Budget that was in response to a proposed budget, and then the skinny budget that was released about a week ago. So these are factual documents that were provided by the administration in the White House. And a lot of people don't understand what's on the table because there's a lot of larger issues that are kind of buried within these budget documents. So to set the stage, the Older Americans Act was passed into law in 1965. We have operated under the Older Americans Act since that was passed. But then in 2012, the government decided that we really needed a standalone entity at the federal level that represented older people and people with disabilities. And that office was called the Administration for Community Living. And I say was called because a little over a month ago, that entire agency was eliminated. They have been dissolved. The Administration for Community Living no longer exists. Those functions were separated into different sections within the federal government under the Health and Human Services structure, some to Centers for Medicare and Medicaid Services, some to the Office of Family and Children, and over half of the staff were fired at ACL. And the reason I raise that is because I think that's indicative of the support to states that run state units on aging, because that's who the state units on aging report to. So that was kind of the number one thing that we saw through the administration. That did not come with any inherent budget cuts. What happened after that on the Pass Back document and now in the skinny budget that's been released is there are targeted eliminations of programs that support older people and caregivers that are extremely concerning to every single office for the aging throughout the state, because these are services we already have turned on for individuals. A lot of people have talked about the changes to Social Security, the potential closure of Social Security offices. That seemed to get a lot of publicity. That's only one component and one piece of this pie. And to kind of give you an idea on the Social Security side, there's only 71 Social Security offices statewide that covers over 55,000 square miles. 40 of them are from Westchester down. So that leaves 31 upstate Social Security offices. So any closure would impact those individuals trying to access those services. But again, that's just on the Social Security side. Then when you look down into other proposed changes, what I'm going to talk about are really the changes that are going to affect the overall older population, which include cuts to the Medicaid program, where some estimates are over 8 million people in the state of New York could potentially lose their Medicaid coverage. We're also looking at significant reductions to the Supplemental Nutrition Assistance Program. People know that as the SNAP program, which would actually either terminate benefits or reduce benefits for people that are dependent upon those. And Donna, you know this, if someone's on Social Security and they have a fixed income and they get $128 of SNAP benefits per month, they depend that as part of their budgeting. We're also looking at the proposed complete elimination of the low income home energy assistance program. A lot of people know that as the HEAP program. That would be devastating to older New Yorkers who are reliant on the HEAP program to provide either heat in the wintertime or cooling assistance in the summertime. There's also been proposed elimination of the Title V worker program. That's basically a program where local offices for the aging assist older people in getting subsidized employment so they can rejoin the workforce and learn about ageism. And obviously cuts to the nutrition program, which would mean cuts to the home delivered meal program. Also in other portfolios that we don't directly oversee, there's proposed complete elimination of the Adult Protective Services funding. Again, here in the North Country, we see older people who are victims of abuse on an ongoing basis. Our local Adult Protective Services organizations provide services to those individuals. And so, that kind of tone is something that we're trying not to scare people, but to have them be educated that these are proposals that have been put on the table for complete elimination. And then secondarily to that, some of the cuts that would impact the North Country, including to the Rural Hospital Flexibility Program, Offices of Rural Health, HIV and AIDS programming. We know most people that are dealing with HIV and AIDS are actually older themselves. Cuts to Alzheimer's disease research, which is really important. Cuts to the traumatic brain injury program. Cuts to mental health, alcohol, and substance abuse programs. And again, a lot of people will say, Becky, well, why does that matter for an older person? The highest rate of completed suicide is in older white men. So any cuts to mental health could impact our service infrastructure. Cuts to healthcare workforce programs to support workforce in rural areas, cuts to food banks. Again, a lot of the older people that we work with are dependent upon food banks to actually fight food insecurity. So really just trying to keep our eye on what will impact older people in the state of New York and work with our federally elected officials to educate them on our service infrastructure. And when I say our service infrastructure, Donna, our average client receiving services in the state of New York is an 83-year-old low-income female who lives alone, has 4 to 10 chronic conditions like diabetes, congestive heart failure, et cetera, needs assistance with their activities of daily living like bathing, toileting, dressing. We serve them on average with this array of programs for less than $10,000 per year on average for 7 years. We know absent those services, 10% of people waiting for them will go directly to a nursing home, and another 7 will spend down their life savings and mortgage their homes to get the Medicaid benefit. So again, targeting these programs that are really low cost and really high yield are not doing anything to benefit government efficiencies. We run some of the leanest programs in the country that support the most vulnerable population. And so really just trying to educate people about the importance of talking about the value of what your Office for the Aging does and why these programs are important. And another program slated for complete elimination that people aren't aware of is the long-term care ombudsman program, where ombudsmen are independent and objective, and they go in and fight for nursing home residents' care. The other program also we're very concerned about is the state health insurance program. Any of your listeners that have turned 65 know they've been inundated with information about Medicare and Medicare plans. Your local offices for the aging are entities that provide you objective information on the right plan to pick. We're not commissioned sales representatives. We're only going to put you in the right plan. That program has been slated for complete elimination as well.
That is a daunting array of services that may be cut. And in fact, the cumulative impact will hit the welfare of all of us, because sooner or later, somebody's going to have to step up to the plate and help these folks. But they're not going to have the expertise and the equipment and the training to do the job that is being done right now. And it isn't just seniors. It's actually the very young will also be very, very hard hit by a lot of these cuts. We are talking about serious impacts on quality of life as well as on longevity, aren't we? And it's not, as you say, about waste, fraud, and abuse. That is not what is going on. These cuts are just being done by people who apparently don't have hearts, and they don't have to suffer themselves. So it doesn't occur to them that other people are going to be suffering with these cuts. So we really have our advocacy work cut out for us on the federal side. We've seen that in 3 months, resistance is not futile when it comes to pushing back against draconian ideas coming out of Washington. So what is needed, and how can the Association on Aging in New York help us be good and effective advocates to push back against these budget cuts?
Well, and to your point, Donna, I think the work that you've seen and the pushback on Social Security changed some of those proposed targeted cuts that were going to happen. So advocacy does work. And so what I would suggest to everyone and anyone, right? If you voted, you have the right and the need to reach out to your elected officials, regardless of if you voted for them or not. I think that that's something I'm trying to make abundantly clear, regardless of political party. If you disagree with cuts to the home delivered meal program, to the other programs and supports that I talked about, you need to make your voice be heard because voices are power and older people vote. I think that's something that's abundantly clear. And so here at the association, we've made it super, super simple. If you would like to reach out to your federally elected official, you can go to our website. It's www.agingny.org. You can take 2 minutes, read the proposed targeted cuts. You can click on your representative and sign your name. We have had hundreds upon hundreds of people that have done that across the state of New York. I would also highly encourage all of you to reach out via telephone, even if you leave a message on an answering machine or with staff, to share if you have concerns about these proposals, because our voices are our power and it's really important to utilize your voice. And again, here at the association, if you have any questions, concerns, thoughts, you can always call our office. We are working hand in hand with our federal partners on an ongoing basis to reach out to the local districts to talk about how many people are being served, what the economic impact of the older population is, and what these cuts would mean. And again, not to induce panic, but if these cuts went through as proposed, we are going to take services away from people that are already receiving them, which would take us, well prior to 1965 when the Older Americans Act was signed into law. So I think it's really important that collectively we raise our voices, that we don't agree with cutting these programs and services. And quite frankly, Donna, I'm all about government efficiency. I'm a taxpayer, but I don't comprehend why cutting access to services and supports that are very low cost and very high yield and are supporting the most vulnerable components of our population. That's not efficiency to me. That's an equity issue like we talked about at the outset of the show, and we need to be able to support people. So again, please feel free to reach out to us via telephone or go to our website, and really just make sure that you're picking up the phone and having those conversations.
You make a very powerful case for advocacy and how easy it is to really do that outreach and how necessary it is. And I do this all the time for a wide variety of organizations on a wide variety of issues that I care about. And clearly, this is something that it's the demographics are we're all going to get older if we live that long, and if we're going to need some kind of service. And we can't go back to the pre-1960 days, because that just isn't going to work. Society is too complex. Needs are too, as you mentioned, intertwined. And we need to help folks now. They've earned our help. And we can't cut them off at the knees because we want to have a bigger tax cut for billionaires in this country. Makes no sense at all. Well, Becky, thank you for coming in. Your voice is so powerful. And your advocacy is just, you're a great example of why agencies like yours make such a difference in people's lives, such a positive difference in people's lives. So thank you for coming in. I hope that people will take us at our word that advocacy works and is absolutely necessary, and we can all push back against some of these terrible cuts. So thank you for coming in.
Thank you so much for having me, Donna. It's always a pleasure.
Well, I hope next time it'll be for better news, my friend.
Yeah, me too.
So these conversations are a production of North Country Matters. This show is a civic collaboration between the League of Women Voters of St. Lawrence County and the Potsdam Public Library. Until next time, remember, our North Country matters.